To help understand the effects of upper body plyometric training on physical fitness in healthy youth and young adult participants, Exal, Garcia Carrillo and colleagues conducted a systematic review with meta-analysis. 35 studies were included in the systematic review, and 30 studies in the meta-analysis, which involved 1,412 participants, aged between 7 and 27 years old, with upper body plyometric training interventions performed 2 to 4 times per week over a 4 to 12 week period. Most studies use a mix of med ball throws, plyometric push-ups, and bench press throws, with med ball exercises being the most common. They found that upper body plyometric training can be effective at improving maximal strength, sport-specific throwing performance, med ball throwing performance, and muscle volume. Based on their review, the authors proposed some guidelines for implementing upper body plyometric training, focusing on duration and frequency, training volume and intensity, and recovery. This is Talking Sports Science with a short summary of their recommendations. Performing upper body plyometric training 2 to 4 times per week for at least 4 weeks is effective. And when it comes to training volume, sessions should typically begin with a warm-up of no more than 15 minutes. From there, athletes can perform a variety of exercises, typically between 1 and 6 exercises per session, with 1 to 6 sets per exercise. This typically results in around 50 to 100 repetitions per session, and it's important to build solid technique through the initial volume before progressing towards maximal intensity movements. And when looking at recovery, rest periods of around 15 to 240 seconds between sets are suggested, along with 48 to 96 hours of recovery between sessions. And that concludes these general guidelines, which should always be adapted to the individual. As always, it's recommended to go and check out the full article. The link is in the description. Thanks for watching, folks. See you next time.